Infective endocarditis. Infection of the endocardium in the lining of the heart mainly affects diseased valves, and the word infective is very accurate because it could be bacterial, it could be fungal, it could be bacterial or fungal, so we call it infective, not bacterial endocarditis but infective endocarditis. Now, how to diagnosis of infective endocarditis. It's gonna always be a fever and a murmur and fever, murmur, fever and a murmur, fever and a murmur. But the major criteria for diagnosis are, what's the first thing to do? Blood culture. The first thing to do is blood culture. The major criteria to diagnose infective endocarditis, you're going to do blood culture and echocardiogram. Which one to be done first? Blood culture. Why? Because if the blood culture was negative, most probably it is not infective endocarditis. Blood culture is the most sensitive test. When I say sensitive test, what does it mean? It's good when it is negative. It's a good negative test. It excludes rheumatic infective endocarditis when it is negative. It has 95% sensitivity. That's why we start first by a blood culture. If the blood culture was negative, we can exclude rheumatic infective endocarditis. If the blood culture is positive, we can do echo. Echocardiography, transthoracic echo, is not very sensitive. You can miss infective endocarditis by echo. Transthoracic echo, you can miss 40% of infective endocarditis lesions. That's a lot. That's almost half. Transesophageal echo has better sensitivity than transthoracic. Echocardiography is a specific test. If you detect something, it is infective endocarditis. But if the echo was negative, it does not tell you. So the two major criteria to diagnose: positive blood culture, positive echo, 100% you have infective endocarditis. The transthoracic echo has 60% sensitivity. Transesophageal echo, much higher sensitivity, 90% sensitivity. Both of them have 90 to 95 specificity. If you have positive echo, you have infective endocarditis. These are the two major criteria. We have minor criteria for diagnosis: fever and murmur and fever and murmur criteria. Risk factor for infective endocarditis, we see it in intravenous drug use, prothetic valve, risk factors for infective endocarditis. And we have vascular or immunologic findings. Some skin lesions, Janeway lesions are flat and painful. Let me show you some pictures for these lesions here. Janeway lesion, it's flat. I move my hand, I cannot feel it. Osler's node, it's raised, and both of them are painful. Osler is raised, Janeway lesion is flat. We can have Roth spots, we can have splinter hemorrhages, we can have conjunctival hemorrhages. All these are vascular or immunologic findings that could be found. We can have glomerulonephritis, and actually the major reason for death with infective endocarditis before the antibiotic era was glomerulonephritis. So all these are minor criteria. So in order to diagnose infective endocarditis, you should have the two major criteria. Are sufficient to diagnose: positive blood culture, positive echo. What if you only had one major criteria? Positive blood culture only, but the echo did not show anything, or positive echo and you had false negative blood culture? You should search for three minor criteria. So one major and three minor, like fever and murmur, risk factor, and one of the immunologic finding. If you don't have any major criteria, it's very hard to diagnose infective endocarditis. If you don't have positive blood culture, if you don't have positive echo, it's very hard to diagnose infective endocarditis, because now you need 5 minor criteria. You need fever and murmur, you need risk factor, and at least 3 of the vascular immunologic findings.